Hello to you all. We will begin today's summit and awards in the next 5 minutes. So I look forward to seeing you all then. Ladies and gentlemen, once again, thank you for joining us here today. We will begin in the next 2 minutes. Good afternoon, ladies and gentlemen. A very warm welcome to you all from the sunny UK. Welcome to the Healthcare Crisis Management Summit and Awards 2020. Thank you all for joining us today, and I hope everyone is staying safe and taking care of themselves. My name is Cara, and I shall be your host for the day. Over the past few months, COVID-19 has changed the way the world operated, but it has particularly taught new lessons and a new normal to the healthcare industry, the hard way. Learning from the crisis that is still unfolding, healthcare leaders will have to chart a new course of action going forward. Despite multifaceted challenges such as combating the healthcare crisis on the front lines while also tackling similar issues as other industries, such as employee safety and economic challenges, healthcare leaders say the best course of action for the future involves planning and facing the challenges head on. This can be done through resilience, reimagining and reforms in emergency healthcare management systems. Hence the need for a constructive dialogue that will pave the way forward in managing the crisis. The Healthcare Crisis Management Summit, powered by Q&A Markham in association with Dubai Health Authority, aims to virtually bring together such leaders from a number of government and private sectors, including healthcare, technology, and insurance to ensure how to manage this crisis effectively. We will also recognise the efforts of the frontline and back-end individuals, as well as the teams that are playing an important role in managing the crisis on all levels. I would like to thank our event partners, without whom this Summit and Awards would not have been possible. A big thank you to ThinkSense.ai, Jenks Systems, D-Link, Reddington Gulf, Novo Healthcare, ICT Circle, Tectonic, and Exclusive Networks. Today, throughout this Summit and Awards, you can ask as many questions as you wish in the chat section below. Your questions will be answered as soon as possible. And the more questions you ask, the more you have a chance of walking away with an Apple Watch. 3 lucky individuals will go into a draw and be walking away with that Apple Watch. So do ask as many questions as you can throughout today's summit. To set the ball rolling now, I would like to welcome Dr. Iman Omar Al-Sheikh, emergency physician, team member, emergency preparedness plan for Rashid Hospital from Dubai Health Authority, our first keynote presenter for the day, who will be throwing light on emergency preparedness and the safety of healthcare workers during a pandemic. Over to you, Dr. Iman.
Thank you, Cara. Good afternoon. Good afternoon. Is it clear? Hello.
Yes, you're clear, Dr. Iman. You can continue, no problem.
Okay. Good afternoon. It's an honor to be part of this webinar. My presentation today will be about the emergency preparedness during the time of pandemic. So before going through the preparedness, we need to know first when we need to predict that a pandemic will occur. This will happen when the 3 conditions have been met. We need to have a new disease that occurs in population, and this disease should be spread easily, affecting the human and cause a serious illness. Each pandemic should go into different phases. We have the first 2 phases where it is mainly animal transmitted, where we start with the phase 4, we'll have the human to human transmission, and also it's called the epidemic stage. When we reach the stage 6, it is the outbreak. Now we have outbreak in more than 2 countries and we call it the pandemic. Why it is important to know all these stages? Because the action you will take in stage 1 and 2, 3, it can help to strengthen your pandemic preparedness and response. Also, you can contain the outbreak and avoid reaching stage 6. Sometimes the situation can go out of control and it will develop rapidly, where you will not have a time to mitigate and prepare yourself. An example for that, what happened during the COVID-19 outbreak. So how can you prepare the emergency department and healthcare system? We divided here into 4 categories. We have the logistic, restructure, administrative, and training and education. If we start with the logistic, we know that pandemic, it's lasts for longer period of time. So you should make sure that you have a sustainable, you should make sure that you have a sustainable supply for the medical equipment, including the medication, ventilator, PPE, and other. Also, you should keep in your mind that during pandemic, there will be a worldwide demand on the medical supply. So you should expect the shortage earlier and you put a plan earlier. You don't wait till it happened to react. Example for what happened during the COVID-19, where we had a shortage in N95. So what was our action? We put a plan B, which extend use of N95 beyond the manufacturer recommendation. Also use a sterilization method for the N95, like the ultraviolet light. And one of the good things that can also help us during the COVID pandemic is using the reusable respirator. If we come to the restructural, here we need to make sure that the department is being utilized to its maximum to accommodate the large number of patients. But in the same time, we should not forget the safety of our staff. So how can we do that? Number 1, to have a clear floor plan. So we divide the department into a zone, depend on the risk of infection. So we have the hot zone where you expect to see the positive patient, the warm zone or the intermediate, the one where you keep the patient under investigation. And then we have the cold zone or the clean zone. Here you keep the other patient who does not, they are not infected and they are clean patients. Another way to restructure the department is to have 2 triage or to have a triage, a separated triage and waiting area for the infected patient. And this can be achieved by having 2 triage. We call it a primary and secondary. The primary triage is to filter the patient. So if the patient is meeting the criteria, you move them to, let's say, triage A, where it's for the infected patient and it's an isolated area. If the patient is not meeting the criteria, then you move them to the regular triage or the clean triage. Another way to decrease the risk of infection is to decrease the number of, or limit the number of entry to the department. So all the staff, all the visitor patient will enter from 1 or 2 points, and you will have a thermal scan to screen everyone coming to the department. Another way for the restructural is to have a physical barrier, like a glass or a plastic window. Here, this we can use it for taking history from the patient, for taking a swab, for example, and this will decrease the risk of infection to your staff. If we come to the administrative part, we need to establish the rule. Each one should know what he have to do and what is his limitation. We need to establish a communication framework. So that's why to make sure that the message reach the right person in the right time and early action can be taken. Also in the communication, it's important to have a liaison person between different teams to help in the communication. And finally, in the communication, it's important that we have a regular meeting, not only in the with the higher authority, also for the same department or same team. So everyone will be on the same page. If we come to the high-risk group staff, like the elderly, the staff with comorbidity, the pregnant staff, this group, we need to move them to the low-risk area. to protect them. And the staff who is working in the high-risk area, we need to do a regular screening for them. And we should not forget the mental health support with the pandemic or disaster that lasts for a long time. Controlling the overcrowd is also important. And this can be done, for example, by limit the visitor to the department. As we know that the pandemic, it lasts for a longer period of time, and there will be a large number of patients. So recruiting a volunteer like a retired nurses and physician, or using medical student interns, or staff from different departments where they are not affected with the pandemic, can help also to contain the large number of patients. Lastly, it's very important the education and training. It does not matter how much you plan, you prepare, if your staff does not know what's your plan and what they need to do. Also, the education should be done for basic information about the disease, how it is transmitted, what's the best precaution they need to take, so they will not misuse the PPE. The education is also for the new staff that you get from the volunteer and from the other department, because dealing with the emergency patient or the infected patient is not their comfort zone. So you need to educate them. And one of the best way to do that is to use the in-time training, which show its effectiveness during the COVID pandemic. Other method of education can be used, like a video lecture, virtual meetings, and others. This was my presentation. Thank you for your attending.
Thank you so much there. A big thank you going to Dr. Iman. Thank you very much for those wonderful insights. We now move on to our second keynote presentation of the day. This is going to be by Dr. Raza Siddiqui, CEO of Arabian Healthcare Group, Executive Director, RAK Hospital. He will be speaking on COVID-19, the impact, challenges and solutions. So I now hand it over, please, to you, Dr. Raza. Dr. Raza is joining us. Thank you so much. Over to you. While Dr. Raza is joining us, I would like to thank Dr. Iman once again for all those wonderful insights coming through. This obviously is a new platform where we do need to remember to turn on our videos and unmute our microphones. Dr. Raza, can you please unmute your microphone in the bottom left-hand corner? And we can hopefully hear you. Dr. Raza, are you there? Do we have you with us? I don't hear you as of yet.
Can you hear me now?
I can hear you now. Thank you.
Thank you very much, Kara, for this opportunity. Thank you very much, Q&A Marcom. And it was wonderful to hear Dr. Inam. Thank you very much for the first keynote address. Kara, can you see my screen? Can you see my presentation?
I can see your presentation. Yes, I can.
Okay, thank you very much. And the topic is very interesting because this is for the first time in the history of the world that healthcare crisis has practically shut down the economy. So it is not only healthcare, the entire world economy is impacted. I will be talking about from the purely point of view of private healthcare providers in the region. No healthcare provider was prepared to deal with such a crisis globally. And as most of the people who are here know, typically healthcare systems are designed to handle emergency treatment, outpatient treatment, inpatient and elective surgeries. What happened suddenly when we were hit with COVID, people were scared and people were scared to come to hospitals. So suddenly what happened, the flow of patients to the hospitals decreased. What happens is 70% of the revenues in these countries are from outpatient and emergency visits, 30% to 40% is from inpatient visits. Due to such an outbreak, healthcare systems in the region and all over the world collapsed. 70% of the business dropped in outpatient facilities and which impacted in inpatient treatment and other elective procedures. Now, what happened that lot of doctors who are specialized doctors like cardiologists, like neurologists, like orthopedic surgeons, practically became defunct because all the elective procedures were stopped and people were scared to come to hospital. And all of us know that COVID does not require basically a super specialized care from these specialists. So over a period of time, for first 3 months, everybody was taken by surprise, and visits to the hospitals by people who really needed care were stopped and they were sitting at home. All these super specialists could not provide service to patients, and it was a great inconvenience to patients. Hospitals started losing revenue to a tune of 30 to 40%. And at the same time, the cost went up significantly because hospitals were committed to patient safety and quality. And suddenly the cost of disinfection, suddenly the cost of PPE went up very high. And we witnessed some situation which is strange, and I think we will talk about it later, that all the supplies also coming from one country in the world. So suddenly that country stopped supplying, and the price of all the consumables, disposables, PPE went up very, very high. Also, we had a big challenge that staff was highly exposed and threatened with safety. So hospitals had a challenge to keep the staff safe, and it was required for regular testing and screening of the employees. So that time and the peak time, it was costing huge amount of money. To test one staff, it was costing 270 dirhams. And to test every staff for the hospital was a big challenge, but at the same time, the morale of the staff was very, very important. This also added to the cost and added to the expenditure, which had a big impact on the operations of the hospital. And hospitals also faced shortage, as we discussed, of the masks, of the PPE, of ventilator, of so many things. In this country, we are blessed to be here, as Dr. Inam said. Within 2-3 months, government came up to the rescue of the entire healthcare system. Government created all the hotels into quarantine homes. They took a lot of apartments and converted into quarantine homes. Government went into extensive testing of the people, because in this case, it is only testing and isolating people and managing them. I think we are blessed to be in a country which has done largest number of testings compared to the size of the population in the world. So the country was able to control, and what happened within 3 to 4 months, they were able to free up all the private healthcare sector from COVID. So all the hospitals now have come back to normal business and are able to provide treatment for the people who really have chronic illnesses and who require hospitalized care. So it was very interesting to watch and to witness this healthcare system in this country. And by the way, we are not that mature healthcare system as compared to other Western countries. We have seen that countries like US and Europe, the public healthcare system practically collapsed, and the whole world is witness to that. In this country, the government managed it so beautifully that everybody had access and has access to testing and treatment. Now, suddenly what we realized, and the panel is full of all technology people, that how important the technology is, and this situation has accelerated practically the use of technology. We have seen telemedicine being used for more than 20 years as a marketing tool. But in this situation, we realized that telemedicine could have been one of the best solutions, because if we had acted proactively, nobody knew what is going to happen. The healthcare providers could have worked with the insurance companies to get it to teleconsultation approval, and also could have created payment gateways to create convenience to the patients sitting at home. What would have happened is this would have acted both ways, for the convenience of the patient and utilization of doctor. So in the comfort of home, people could have got consultations, teleconsultations, and all other facilities to be provided by the hospitals. Some of the hospitals were prepared, some of the hospitals were able to take care, but the lesson is that going forward, we have to focus on automation. We have to focus on AI, artificial intelligence-based diagnostics. We have to start seriously considering wearable devices and remote monitoring of chronic patients. We as a hospital, RAC Hospital, we are also looking at robotics, basically for disinfection, for food and medicine delivery. So basically, COVID has really accelerated the use of technology, and we all have to start working and focusing on the use of technology, automation, big time. Also, we have learned a lesson that a lot of people with chronic ailments actually need not come to hospital. A lot of things could be provided to them in the comfort of their home. So home care, I think, is one of the solutions for future, because a lot of people don't have to revisit the hospital for the same complaint again and again. One more lesson we learned, and which could be a good solution for future, that single specialty hospitals and centers, how important they are. Suppose we had more mother and child hospitals. Suppose we had more cardiac centers. We had more bone and joint centers. We had more standalone diagnostic centers. So these 4 or 5 months could have been much better managed, because all these patients who could not take consultations and right kind of medications and could not see their doctors would have felt secure by visiting such centers. So I think a possible solution for future is that we have to start looking and seriously considering setting up single specialty centers and diagnostic centers. Because by default, all the hospitals in the region are designed as multi-specialty hospitals. So this is one of the possible solutions for future. We have a good panel, and I've seen the credentials. A lot of people have the IT and technology background. I wish you all the best for the rest of the session, and it will be a great learning for everybody to learn from the IT people and the technology people what are the possible solutions going forward to manage such crisis in case it happens again. Thank you very much.
Thank you so very much there, Dr. Raza. Thank you very much once again for all those informative insights. So we would like to now move on to the first panel discussion of the day. Our first panel discussion is on telehealth and remote support. So, our esteemed panel of experts discuss how telehealth has helped expand access to care at a time when the pandemic has severely restricted patients' ability to see their doctors, as mentioned there by Dr. Raza. So, to moderate the session, we have Arun Kumar Krishnan, CEO at Al-Noor Group of Clinics. And I'd like to welcome our esteemed panel. We have Dr. Yasser Naklawi, Chief Medical Officer for Al Zahra Hospital, Dubai. Dr. Ahmed Salah, Director for Corporate Medical Services, Prime Healthcare. And Fodil Ben-Turkia, Founder and CEO for Okadoc. Please, ladies and gentlemen, do remember that you can put any of your questions onto the chat section on that Q&A icon below. We will, at the end of the summit, be pulling a prize draw. So you will be walking away with Apple Watches. So do ask as many questions as you wish, and our panelists will get back to you in due course. Enjoy the session. You have 25 minutes, and I hand over now to you, Arun Kumar. Do we have you?
Yes, I'm here.
Thank you so much. Enjoy.
Thank you. Good afternoon, all. Thank you. Thank you. It's a video off, right? Thank you, Clara, for a fantastic introduction, and I'm honored to be part of a fantastic panelist. Welcome, Dr. Yasser, Dr. Ahmed, and Fodil Ben-Turkia. So, are we all on board, right?
Yes, Dr. Yasser here.
Yes, good afternoon.
Good afternoon. So it's a great pleasure for me to talk about one of my interested topic, role of telemedicine and laws in managing healthcare during this crisis. And I welcome all of you to have a fantastic discussion, which will be very informative for the listeners as well. So I think I will direct the question directly to Dr. Ahmed, being with Prime Healthcare and having both primary care and hospital segment. How has COVID-19 changed the outlook of telehealth? What are the challenges facing to use the telemedicine right now? Dr. Ahmed?
Yes, good afternoon. Thank you very much, Mr. Arun, for the introduction. I will start with the first part of your question. Yes, the COVID-19 crisis has changed the outlook of the telehealth. Let's first of all agree that, as mentioned also in the keynote, that telehealth technology and its use are not new. The only thing is the widespread adoption among the healthcare professionals and patients beyond simple telephonic correspondence has been relatively slow before the COVID-19 pandemic. The trends now show some increased interest in the use of the telehealth services by both healthcare professionals and patients. The recent policy changes during the COVID-19 pandemic have reduced barriers to telehealth access and have promoted the use of telehealth as a way to deliver acute, chronic, both primary and specialty care. Many professionals, medical societies endorse the telehealth services and provide guidance for medical practice in the evolving landscape. There was 2 points which we need to discuss. One is from the healthcare provider point of view. During the pandemic situation, there was a need of a change of the way they deliver their healthcare services, the way they triage, evaluate, and care for their patients. And in the same time, they wanted to reduce the staff exposure to ill persons because they were the frontliners and their presence during the crisis was very much important. On the other hand, is also to preserve the personal protective equipment, the PPE. And as mentioned earlier, it was on a high demand and a very shortage way. And of course, minimize the impact of patient surges on the facilities. So the healthcare system have had to adjust the way that they triage and evaluate and care for the patient, and using methods that do not rely on the in-person services. This is from the healthcare provider point of view. Coming to the patients themselves, where during the pandemic situation, there was a lot of restrictions and precautions which were required to be maintained and followed. So the challenge was that during the lockdown or during the restrictions of the movement, how can the patient be connected with his healthcare professional, especially for the chronic patient, and how do they reach to the service providers? So the telehealth healthcare system has provided that solution during the pandemic situation. On top of this, if we look at the fear factor of the patients to visit a clinic or a hospital for a simple acute condition was also a kind of barrier, which the telehealth solution has solved this issue. So this is that is for the first part of the question. Coming back to your second part of the question on what are the challenges that can be faced in implementation and use of the telehealth. First, we need to look at the licensing part of the telehealth services and how the telehealth services are governed within the country. And we were very much fortunate that the government authority of the United Arab Emirates have eased many of the restrictions on the use of the telehealth during the pandemic situation. Some of the challenges which was also mentioned in the keynote were the adaptation of the insurance companies and their policies on the use of the telehealth and especially the teleconsultation. Telehealth services itself.
Yes.
Telehealth services itself also. Yes, Mr. Arun.
Yeah, there was some. I think the video is on only right now. Please continue.
Okay. So the telehealth services also has its own limitation in identifying and managing some of the conditions that may require or must require an in-person physical examination and management by the healthcare professionals. Other challenges which we can talk about is also the availability of the softwares and connectivity, the smart devices, which it might not be the situation in the United Arab Emirates, but it might affect some other countries. The level of comfort. Yes, Mr. Rubu?
No, continue. I will just ask.
The level of comfort of using the technology itself by some of the healthcare professionals as well as the patients are also some of the challenges which we may face in implementing the telehealth. Yes, please. Coming back to you, Mr.
Yeah, thank you very much. And just to see, we understand that telemedicine has made telemedicine technology more accessible, and patients they love to use telemedicine or teleconsultation right now, which they were not happy to use before. So from the primary care model, even if there is a COVID or not, post-COVID, what do you think the telemedicine can do?
Yes, thank you very much for the question, Mr. Rao. I believe that the telemedicine now is very much adopted by both the healthcare professional and the patients. There were some hesitation from the patients to use the telehealth earlier, but the pandemic situation has provided an area where the people could discover the use of the telehealth. I can say that, for example, a chronic patient do not need to visit the clinic or the hospital on a frequent basis, and they can have a follow-up consultation with their physicians and renew their prescription or refill their chronic medication. Some of the simple acute conditions, if you have, for example, a remote monitoring device to measure your temperature, your blood pressure. Yeah.
Thank you, Dr. Ahmed. As we have a very limited time, and I would like to extend this question to one of our techie guy in the panel, Mr. Fodillo Bentocchio, who has been a very successful CEO of Okadoc, and let's hear from him. What action should healthcare stakeholders take in the near term to shape this opportunity?
Good afternoon, everyone, and thanks for having me today. I think the healthcare stakeholders, when it comes to the actions to be taken, when we look at the regulators, obviously, clearly the regulators have started before COVID-19, shaping the regulation and licensing of teleconsultation for both the platforms like us, but also for the healthcare providers. And I think if there are actions that I see that could be continuing in this sense, and this is quite amazing because even during the COVID, we've seen a lot of initiatives and support being given to both the healthcare providers, to the platforms by different regulators. I think one of the challenges that an action can be taken is to having an harmonized maybe a regulation in the UAE. That gives obviously some challenges at the beginning, in having a technology that is applicable to a different regulation within the country. But we also see this as a challenge for healthcare providers because a patient who's maybe working in one Emirates and living in another Emirates, then the video consultation, the prescription might not work if it's not covered, if it's not in the same Emirates. So these are a few challenges that I think will be most probably tackled soon, but definitely compared to other countries where we at Okadoc are present, the UAE is definitely well advanced and has been really agile in this perspective. The other action that I see from stakeholders, if I move to the payers, to the insurance, I think a very quick move as well in covering most probably more than 80 or 90% of the insurance companies started covering the video consultation for patients.
Right.
And I think what's something that we've seen as well in the US at the beginning is that the coverage was not the same as if it's an in-person or a normal consultation. But that in the US, it became like, we've seen kind of similar coverage. I think one of the action that would be really encouraging and growing the video consultation adoption by both healthcare providers and patients will be having a similar coverage, right? In terms of amounts that is being covered and the type of consultations. From a healthcare providers, it's been at least working with so many healthcare providers. What we've seen is that amazing actions have been taken. Being a caregiver, allowing any kind of regulated, approved solutions to be given to their patients, and in such a short period of time was really amazing. Again, compared to many other countries, you won't see this kind of agility from the healthcare providers. I think one of the actions that could be taken by healthcare provider, which is already taken, but it's a matter just of time, I guess, it's really to integrate these solutions to their existing hospital information system, to their existing processes, so it does not become like a manual process that adds even more burden or inefficiencies in their operation. And this is something that is happening. As an example, we have integrated our solution to already 5 or 6 hospital information systems, and this is clearly something that is very important. From a patient perspective, I think, as Dr. Ahmed Saleh mentioned it, and I think it's very important, patients are seeing the benefits. I think they're really enjoying the video consultation. They're saving a lot of times, instead of going to the parking, as Dr. Ahmed mentioned. For a chronic patient, if you just need a prescription renewal, you don't necessarily need to take your car, go to the hospital or clinic, find a parking, wait. It's a process that can take 2 hours for you to leave your house and then come back to your house, while it's a 10-minute video consultation that can be done from the comfort of your home. But clearly, I think there's great adoption from patients. I think a bit more, communication and availability, for those patients will definitely keep growing this kind of new.
Thank you, Fadil. And it's great to know that, okay, there is a great acceptance from the patient as well as the stakeholders. And the only thing, it has to be a little bit more, I know some catalyst has to be there, and COVID has become a catalyst to, accept telemedicine as a solution. And we expect that, okay, there will be great technology changes happening post-COVID. And thank you very much for your presentation. And let us invite Dr. Yasser, CMO of Al-Sara Hospital, and he's also the chairman, consultant pediatric at Al-Sara Hospital, American Board Certified Pediatrics and Adolescent Medicines. I think Dr. Yasser can add more, because we have seen a great drop in pediatric patient also coming, low patient flow into the primary care as well as the hospital. So what telemedicine, what is the future of telemedicine during and after pandemic? Welcome, Dr. Yasser.
Welcome, and thank you for having me in this esteemed panel. Very nice information and really very beneficial. The way I can see that healthcare system is having a huge appetite for telemedicine for different reasons. It's going to be the new normal. It definitely is going to impact the healthcare system in so many ways. Just a few examples. It will increase the access of patients to their doctors. It will decrease the costs, decrease unnecessary ER visits, and will decrease the delay in the waiting rooms, and also it will decrease the no-show. So this all good things that making healthcare system really want to adopt more of telemedicine even after the pandemic. I think my colleagues elaborated a lot about using telemedicine during pandemics, but I would like to touch on what is the new normal, how telemedicine is going to change our practice, how it's going to impact us as a healthcare providers and impact patients and their access. Let's start with chronic disease management. As was mentioned before, a lot of patients with chronic illnesses may come to get a new prescription or adjust their blood sugar and high blood pressure. Now, there's a lot of gadgets that can record blood sugar and even EKG, heart rate, blood pressure, and can be transferred to the doctor through telemedicine or through a lot of smart apps that we see emerging. So this is going to be the future. More patients are staying home and with chronic illnesses and being managed at home. The second concept is the hospital at home. Hospital at home concept is going to be emerging in the next few years. Treating conditions like chronic obstructive lung disease, pneumonia, heart failure, definitely the patient does not have to stay the whole time in the hospital. So that will give room for early discharge, and the patient can continue the management at home via telemedicine. Especially in Dubai, adopted the DRG, and that's definitely will help hospital financially tremendously in decreasing length of stay and taking care of the acute problem in the hospital and continue management at home. Third X will be like for acute conditions, some acute conditions that can be managed over telemedicine. And this can be if a consultant would like to do round in a remote area. So, I mean, they can continue as if they are physically rounding on patients through telemedicine, like stroke patient. We already seen radiology, great success with radiology. Not every hospital have to have super subspecialized radiologist. Maybe there's be one or two in the area, and they can be consulted through telemedicine. specialized studies like cardiac MRI, cardiac CT, is not feasible for every hospital to have such super specialized physicians. So this definitely telemedicine will help on rounding, and let alone mental health. Mental health, definitely a good field that will see a lot of progress through telemedicine. So this is going to be our new normal, new future. And I think we all have appetite to explore more. New gadgets are emerging, new smart apps and smart devices is going to help in that regard. Thank you. Back to you.
Thank you, Dr. Yasser. It was very informative, and I understand there is a lot of possibilities still telemedicine can do. So as a quick roundup, I give an opportunity for everyone to have a keynote. Just I welcome back Dr. Ahmed.
Yes, thank you, Mr. Arun, and thank you, Dr. Yasser, for your wonderful note, and Mr. Fodi for your wonderful note. I believe that the future will be for the healthcare technologies and for the artificial intelligence, and this is only the first step which we are going through. And telehealth as a technology tool has helped all the healthcare providers to go through this pandemic situation very efficiently and successfully. Thank you all. Thank you. Have a great day.
Thank you. Mr. Fodilo, please.
Yeah, sure. Look, what we see is from video consultation to online appointments to payments and any kind of interactions between patients and healthcare providers, what we see is that is just going to increase. I think healthcare providers have been having amazing and very advanced technologies within the hospital information systems and ERPs. And these are technologies that have been built to serve and operate within the facilities. Now, what we are seeing is all the technologies that are interacting between the healthcare provider and the patients, right? So I think there's definitely a bright future, and I think the adoption will not take 10 or 20 years, maybe like other industries. I think it's happening already very fast, and I think in a couple of years, it will just be the new normal.
Thank you. It's too promising, and we are expecting from a startup specialist like you to do much more into this telemedicine field. We wish you all the best. Dr. Yasser, once again, to wrap up.
I think the decision makers in any healthcare system now, they have a huge appetite for technology. Given the fact that it served us tremendously during COVID, and a lot of purchases were put on the back burner, now we are really eager to utilize every piece of technology that can keep our patients safe and give us a best healthcare outcome and good patient experience.
Thank you all the panelists. Before wrapping up, let me just put what I have learned from the great panelists. So telemedicine, AI, IoT, these are going to be the new norms, new normals. And the new normal is the word which I liked, for the take home. So let's hope we have a huge shift towards the technology part. Let telemedicine and AI, IoT together bring benefits to the patient, whether it's a chronic care or whether it's on the primary care or bringing down the cost, protection for the patients. So that's all. Thank you very much. Back to Kara, and I think we are on time.
Thank you.
Excellent timing there. Thank you so much, Arun Kumar, and to all our panelists there. Very concise. That was excellent. And to this new normal that we are all in right now, gentlemen. Strange, crazy times. Thank you once again.
Thank you, Kara.
Thank you, everyone. Bye-bye.
Okay, moving on now to the second panel discussion of the day. The COVID-19 crisis has put new pressure on health IT infrastructures. and they were already straining to accommodate an explosion of data. So now we watch top industry leaders discuss the future of healthcare technology in the next panel. To moderate the session, we have Ramakrishnan Natarajan, Vice President for IT Emirates Hospitals Group. And I'd like to welcome our esteemed panel. Dr. Mohammed Khalid, PhD, VP Critical Infrastructure Protections and Resilience for Group 42. Sumit Singh, Group CIO, VPS Healthcare. Vignesh Unadkat, COO for Thambay Technologies, Thambay Group. And Saqib Chaudhry, Head of Digital Innovation and Development, Cleveland Clinic, Abu Dhabi. Please, ladies and gentlemen, do remember you can ask your questions on the Q&A button just below, and our panelists will get back to you as soon as possible. Please enjoy this next panel discussion, gentlemen. Thank you so much.
Thank you, Kara. What an amazing panel discussion we had, one of the most pertinent topics. And over to this session, we have the cream of the healthcare industry with us here today. And let me, without wasting any time, let me set the agenda. What are the things that we are going to discuss today? This will include how can technology meet the security and performance challenges of telehealth, smart devices, and other next generation healthcare tools. What are the security considerations for health, and how can data privacy be ensured in a time of transition? So without wasting any time, let me start with Sumit. Sumit, the way in which the healthcare is delivered was already evolving at a rapid pace, but COVID-19 crisis has accelerated this transformation. Digital health technology has played a crucial role in the fight against the coronavirus. In this context, how is the new data explosion being managed by various organizations, and your take on that?
First of all, good afternoon, everyone, and thank you, Ramakrishna, and thank you, Q&A, for having me on this panel. I could not agree more that the COVID-19 pandemic has greatly accelerated the adoption of numerous digital solutions across all industries. And who could have imagined probably a year ago we meeting on this platform like this, probably we would be in the room together. And healthcare has been actually a shining example in such a digital solution adoptions. In a very short time. Partly but because of compulsions, partly things were already available, and we just didn't have the catalytic event, so to speak, to get on there. Before I get on to the management of data itself, may I just share that we ourselves had to actually scramble and put together fever clinics, quarantine centers, and even I would say set up brand new labs. How do we use our beds very effectively? How do we use our clinicians very effectively? How do we place our people at the right place at the right time? All of this needed to be put in place, and they all actually required solutions that probably were not actually paying too much attention before. We had to put together a command center of some sorts and centralize a lot of our operations. VPS, like many of us probably over here, is a group of entities spread around, and a lot of them were functioning quite independently. And so we had to put together such that in some ways data is put at one place, and then you can take some informative decisions based on that. And frankly speaking, I don't see this thirst of data reducing anytime soon. In fact, I would say that at this point of time, it's just been a trailer or a precursor of what's more to come. There's no going back. That's the as the previous panel rightly said, it's the new normal, and the new normal what we have seen is actually just the dawn of the next wave of digitization in the healthcare. I mean, traditionally it had been said that maybe in the banking industry, maybe in other industries, it had been quite a bit more of ahead of the curve, so to speak. We've now caught up. So the question, about data management, right? I mean, I think what I would first put together is all data is not equal. To manage data, effectively, you will have to, start with, thinking that whether what you are getting all this data, is it all really pertinent? Is it all really useful? I mean, it is very quite easily said, data is the new oil. We live in an oil, kind of a rich environment, but now we say data is the new oil. But as you would imagine, even oil, when pulled out of the well, so to speak, is not really easily consumable. It has to go through a refinery process. Likewise, even the data has to be actually seen through that prism. Quite often, it is in silos. Quite often, even within, an organization, it is not talking to each other. It presents its own, flavor of it. So by itself, the data management, process needs to evolve a bit, and before it becomes usable, there are a few steps, that it has to go through. You have to probably, do some, maybe data deletion or correction, maybe some transformation, put it through some analytical tools. Maybe you have to use some, AI platforms, maybe, a BI platform, so to speak. You have to make it presentable, visualization, and then only probably data becomes, usable. I mean, data is data. After all, it has to be intelligent information on which, that particular thing becomes important. So to me, data management starts from there in some ways. And at the end of the entire process is the data democratization, by which you actually, give the right, actionable intelligence to the people, who need to. I mean, your supply chain, team may require certain type of data. Your clinicians require some other type of data. Your, institute may require something else. So that's the context, of the entire data that you may be, putting together. I mean, now we talk about data storage being cheap, but let's not go crazy about making and holding everything that we get. You've got to go through that process. Having said that, I think the first and obvious, obligation that we all have is to meet our, legal requirements. I mean, I think they are generally well known, and they haven't really changed as much. I think there's a lot of adoption. So first, to ensure for any organization's perspective is to meet that requirement. When you have moved that, I personally think there are, two aspects of it. Like I, mentioned briefly. First of all, look at from your resources. Your companies or organizations' data maturation process. Are you as an organization ready, or which part of the maturation process actually you are to consume the data itself? There are various stages you probably can look up into that. If you are trying to wade yourself into the deep end of the pool, probably you will be maybe getting into a position where your organization is not ready. So you have to basically raise the bar, so to speak, of your own organization, of your own team, to basically manage the right type of data that is basically useful to them. And secondly, understand that data by itself has a shelf life. I mean, all data is not relevant. I mean, something which is really fresh and probably has a more what do you call that, significance than something that is really not as pertinent, or maybe not as recent, so to speak. So you will have to have a strategy, so to speak, a data governance model or data governance kind of a team, so to speak, that differentiates between what is pertinent, what requires to be retained, and what probably is apt for being discarded. And so that actually is there's no one size fit all type of an answer for that. You would, as a leader of an organization, have to think that through a little bit more closely, along with some certain people within the organization. I think these are my two main suggestions when it comes to data management. I would say to create a data retention strategy, so to speak. Raising the awareness of data utilization, making a data-driven organization, then the data management piece will actually fall into it. I think that's my 2 cents on this topic, and welcome some questions. And otherwise, back to you, Krishnan.
Thank you, Sumit. I think you have made a lot of key points here. One of the most pertinent one is the classification of data, where you really need to know what's pertinent for your organization and what's not, and the standardization and the shelf life. I think thank you for that revelation, and I do agree with you on that. Which in fact brings me to another question I would like to put to Dr. Mohammad Khalid. This is about the pandemic has brought new big data driven practices of infectious disease surveillance to the forefront of efforts to track cases in real time. The COVID-19 trackers, they pull data from sources around the world and are helping healthcare workers, scientists, epidemiologists, and policymakers aggregate this information. Now, Dr. Mohammed, what do you think is the impact of this?
I totally agree with Mr. Sumit. I will continue where he has started. We are in digital era, not anymore. At the same time, we are in the digital era. So people keep saying we are on that one, and we are already not on that one. We are actually on the data era. We are not in the digital era, because the data era is the first step of the digital transformation or the digital era, because without the data, I don't know where is my data, where is it located, where it goes, and who's using my data. I want to be able to accelerate the digital transformation. I want to be able to be ready for the future. I always keep saying we need something called readiness, interconnect, intelligence, and defense. If we have this all circle of the information or the data, that helped me to plan my situation right now and to do the proper decision that I needed to manage the pandemic or to manage any crisis could be happening in the future. At the same time, I'll be able to know what the forecasting and what will be could be in the future actions should be taken into considerations. And let's take it one step back. We always delaying our decision making, or let's say we are not doing a proper decision making in certain situation due to the lack of the data. It's not a matter of the lack of the data, where it's a matter of the lack of the interconnected data. That's what we have to look for it in order like to have situation awareness, manage the crisis at the same time to know what in the future should be happening. But it's simple as that. In the certain hospitals, I need to know where is my doctor located right now in order to respond to certain cases. Are we able to locate it right now? Yes or no? And how far we are from that one? Because if I'm able to locate a doctor, that means percentage of life protections are gonna make it. That curves will goes up. So we need to do the data classifications in order to plan for our future, in order like to predict what is the first step to be digitized, or more importantly, from the process to be digitized. Always doing data classification once we are doing data leakage prevention solutions. Document level and the email level, on the let's say any things that we are working on it from documentation perspective. But we don't do data classifications once it comes to data exchange or data sharing, or once it comes to the interconnectivity, once it comes to the database level. So that's why we have facing delaying in the certain processes or certain actions. It has to be digitized. But that's why we have right now to think seriously and in actionable way to start classifying our data in order to see how far we are from the decision making, how far we are from the digital transformation, how far we are from the situation awareness. Because if I'll be for example, from these data management, I'll be able to know how many masks I've been using, how many Red Bull we start consuming, or let's say how energy drinks we start consuming this pandemic. This is like an indicator that there is like, we need to have like plan B, or let's say medications, or let's say new line of productions for energy or power medicine. For example, for certain sector, we need to know which sector to be focused in terms of to rectify the situation. Based on that, we'll identify the percentage of readiness to response to crisis and the post worse than the scenario that we are facing right now.
Thank you, Dr. Mehmet. I think very, very eloquently and excellently put. Let me go to another aspect out of this pandemic, where let me put this question to Mr. Vignesh. There is also another and often forgotten dimension, which is the monitoring of existing non-communicable diseases, which is largely displaced as the central activity of health systems that are now totally focused on managing the pandemic. What is the potential here for technology and digital solutions to enable for better self-care?
Okay, good afternoon, everyone, and thank you, Q&A Marcom, for inviting me for this panel. Well, before I start, I think I should really appreciate and thank the government of UAE, which has been a very agile and bringing these new policies and closing the gap of IT and the healthcare policies, so that we could all join together and be a part of the healthcare team to provide them whatever they wanted. So I think it's a wonderful job by the government. As you mentioned, and our panelists mentioned, that there is a huge data which is going to be managed now, because we have started collecting data in every point of the healthcare. Like, when a patient comes in, the data has to be collected. When the doctor sees the patient, he needs all the previous history. So the data is huge. And again, what happens is the self-healthcare. People normally, what happens is they don't bother about keeping their data with them, because they know that, okay, this hospital is going to, when I go to the hospital, they're going to give me the previous reports. But I think, as you mentioned, that self-care is going to be more important in the future. And there are going to be devices and gadgets which are going to come out in the market, where it will give you your vitals on a daily basis. It will give you your temperature on a daily basis. And the person who's going to wear them is going to definitely keep a record of it, that whether my temperature is okay, not okay. So this data also would be important to link it to the hospital which he is going to, so that they can monitor an individual in a better way. And I think in the future, what is going to happen is preventive care is going to be more, as a hospital, people would rather advise the patient more on preventive care rather than, person coming in. So there are a lot of gadgets which I think have come in the market. So the sad part of the pandemic is, yes, there are people who are infected, and but looking at the positive side, I think the technology companies who are going to bring out innovative solutions are going to make money. And it's a big opportunity for all the technology companies out there to come out with a real innovative solution which is useful for the patient and the healthcare provider, which will close in the gap. So that is one particular thing. And what I would like to add is that, it's telehealth was there 20 years back. AI was there 20 years back. Everything was there, but it has come so close that it is being used in our daily lives. Like, for example, AI is being used as chatbots, where patients are being advised over chats that, okay, you can see this doctor and you can book an appointment with this doctor. There is AI is taking shape in also being used to give advice to the end user that this is what you need to do. So it has become usable. The technology has become usable. And I think for healthcare, a revolution has started, just started, you can say. And there's much more to come. We will see a lot of changes. And, earlier what happened is when a patient comes to the hospital, you will see that he will know what the disease he's having and what type of medicine he has to take. He will go to the Google and he will understand what it is, and he knows, as if he's, but now he's going to come up with some data along with it. He will say that, my blood test was there. So I think there's a big change going to come. And even in terms of telehealth, what I foresee is like, we would, UAE being an hub for medical tourism, we can expect people from other countries doing telemedicine or having consultation with our doctors here. Also, there could be competition because people from here also could do teleconsultation to other doctors outside. So I think there's a whole paradigm shift going to happen with all these technologies coming in and being usable. So as a key message, the revolution has just started. Wait and watch. There are a lot of changes going to happen, and it's good for everybody.
Thank you so much, Vignesh. I think I agree with most of all your points, and especially when it comes to smart health devices, which were a kind of a sci-fi thing in the past, but they are already there in the market, and people have already started using it, and even more preferring to have to change the venue of healthcare from hospitals to their homes. So definitely that makes an impact.
And also, there was a mind block that whether if I go to the hospital only, I'm going to get a proper treatment. But now that mind block has gone, they also say that, okay, sitting at home, I can consult a doctor and it is going to be comfortable.
Even as per one of the surveys, it seems that the elderly people are more likely to go for these innovative solutions than people of our, in their middle ages. So because it gives them the comfort of getting all the care they need from the home. So that's really important. And so Vignesh, I mean, since you have made this point, I would like to get the key messages from all our panelists for what they would like to, tell the audience on the future of healthcare technologies, and what is your message that you would like to tell the audience today. So I'll start with Vignesh yourself, because without wasting the time on.
Well, future of healthcare is going to be very bright, and involvement of technology is going to be more and more every occasion, whatever happens. And I'm sure that this will give better care, and it will be giving quality care to the people who are seeking healthcare. And it is going to improve their experience, because I would just take 1 minute, when we are talking about data, and what we have done is we have started an exercise of actually, when you're collecting data, there's a lot of repetitive of you repeat. Sometimes it so happens that we don't know that this data is being taken in 2 points by the same people. So when you come in, you might register, and then again you take some other information. So you can look at the whole process to reduce collecting repetitive data. And also we have done one innovative project in all our Tumbe that we have these now cameras who are detecting the face, and they're asking we are going to use that same to also, when it goes to the reception, it will be like a face recognition to recognize the file also. So automatically the file opens with the face recognition. So you don't need to really have the card being given or your Emirates ID to be given. Once it is scanned and put in, then the face recognition will take over the next thing. So I think there are a lot of these small innovations which are going to come up in the future, which is going to be bringing a big change in the healthcare industry.
Thank you, Vignesh. I think we have another panelist with us, Mr. Saqib, who is the head of innovation in Cleveland Clinic Abu Dhabi. Camera is not on due to technical reasons, but I have a question for him, which is very pertinent to his role as well. Saqib, could you tell us, do you think COVID could spark a positive change in the world of digital healthcare? And what kind of change are we expected to see?
Thank you, Rama. Assalamu alaikum, and good afternoon, everyone, and apologies for not being able to project myself on the screen. Albert Einstein once said that in the midst of every crisis lies a great opportunity. And I strongly believe that this is true for COVID-19 calamity as well, at least for the healthcare industry. Now, there have been quite a few positive changes in the world of digital health as a result of COVID-19, but I would like to discuss a few of them. The first one, and I think it has been discussed many times over during this conference, is telehealth. COVID-19 has forced various healthcare systems across the globe to either launch their own telehealth services or to significantly enhance and expand their existing services. We also have our own telehealth services, which we have termed as our digital front door for our patients. We continue to rapidly expand and promote our digital front door and are seeing an exponential uptick in patient adoption. Now, one important thing to address or to discuss here about telehealth is prior to COVID-19, most governments and commercial health insurance plans limited the reimbursements for virtual consultations, and health systems had little incentive to adopt telehealth. However, with COVID-19, insurers are expanding telemedicine reimbursement, which is a good news, which has also helped greatly in fueling telehealth growth. The second area I wanted to highlight is robotics. In response to COVID-19, various health care manufacturers and providers have become more accepting of the idea of using robots. This is to reduce the overall risk of exposure, especially to their frontline medical and administrative staff. Robots of different kinds are being developed and used to assist healthcare professionals in various aspects. While most of the robotics had been used and has been used to assist with surgeries, however, with COVID-19, now robotics or manufacturers are designing robots that can do mundane tasks, for example, sanitize the environment, deliver food to patients, or medicines to patients, thus minimizing physical interaction with patients. The third area I would say is 3D printed medical equipment. So COVID-19 created a huge shortage of various types of medical equipment. And to address this change, one of the areas that organizations looked into, or medical devices manufacturers looked into, is 3D printing. Now, 3D printing is getting used in producing equipment such as ventilators, face shields, oxygen masks, part of virus test kits, and other protective gear to deal with this pandemic. Next would be the increased use of artificial intelligence. It has been significantly adopted because of COVID-19. Several healthcare providers across the world have started using AI, which has helped in expediting diagnosis and assessment of diseases, particularly COVID-19. I recently read that a group of scientists are using AI to identify an underlying genomic signature for 29 different DNA sequences of COVID-19, which is an important tool for vaccine and drug developers. Other applications of AI, especially during COVID-19, can include virtual chatbots to spread health and wellness information and address basic patient queries, thus minimizing physical contact. AI, along with virtual consultations, robotics, use of big data analytics, is also helping to tackle COVID-19 outbreak and flatten the infection curve. In other words, geographically identifying spread patterns and then be able to put in the controls to mitigate it. And lastly, remote monitoring and in-home care by relying on IoTs. This has also picked up during COVID-19. The use of wearables and home diagnostic devices is helping with the screening of new health patterns. It is helping with alerting patients almost in real time and prompting clinicians to intervene when a notable and actionable anomaly arises. So that's all from me, Rama. Over to you.
Thank you, Saqib, for your visionary views. And I think your views are already have the future vision or message to our audiences. I would like to go to Mr. Sumit for his message to the audience.
Well, I mean, thank you again. If one can even characterize it, if having a silver lining on this COVID pandemic, one can only imagine, I mean, I have to put that way, is this, rapid adoption, acceptance, of technological solutions that were probably there, in the back shelf, so to speak. And I see that as a very encouraging change, and the impact will be immensely felt over times to come, and that's the upside to this entire COVID-19 crisis, I would just say. And
Thank you, Sumit, and Dr. Mohammed, for your short message.
My short message is we have to prepare for the post-pandemic in two things. Point number one, we have to evaluate ourselves, how we are ready or percentage of readiness before the crisis happened, during the crisis, how much we are ready to respond to it, and in this moment, how much we are ready to respond to it, and how much we are ready even in worse than this pandemic. And that's coming only from the data. We have to have the interlinked data and evaluate each and single sector, not only the health, education, business, and whatever sector impacting each other. Health impacting education, education impacting trading impacting tourism, all of this interlinked to each other, and percentage of impact. Not coming only from the data classification and understanding and putting, we have to put right now a mechanism or formula, let's say, or the equation calculating this risk with a percentage of readiness.
Thank you, Dr. Mohammed. We have had an excellent panel discussion today, and we discussed on a wide range of topics, right from manageability of data to the role of technology on better self-care, and most importantly, the future of healthcare. Thanks to all panel members for sharing your invaluable insights, which I'm sure all the attendees will take away with them. Thank you. Back to you, Kara.
Thank you so much. Thank you, Ramakrishnan. And thank you to all our panelists. Excellent panel discussions there. Thank you. Dr. Mohammed, please take it easy on that Red Bull. Too much Red Bull does not give you wings.
Energy drink. I don't want to say later on that I'm doing a promotion to Red Bull. No, it's an energy drink.
Extra commission. Okay, thank you so much, gentlemen. Now, moving ahead to our final panel discussion of the day, crisis management and changing face of healthcare will be the topic in discussion. This panel will discuss how the safety of patients and frontline workers is paramount, and the contingency plans that have been set up while normal operations are interrupted. Now, to moderate the session, we have Helen King, Senior Vice President for Quality and Nursing at NMC Healthcare. And I'd like to welcome our esteemed panel for this. We have Emmanuel Azad Munissa, PhD for RD Associate, Professor Health Administration and Policy, the Mohammed bin Rashid School of Government, Dubai, UAE. We have Dr. Aniruddha Lahiri, Director of Administration for Zulika Hospital, and Dr. Sally Mahmood, Lab Director and Clinical Pathologist for Group 42 Biogenics Labs. Over to you, please, if we have you, Helen. Thank you so much.
Good afternoon. Thank you, Kara. Can everybody hear me? Can everybody hear me?
Yes.
Yeah,
Yes.
okay, great. Thank you very much. Thank you to DHA and Q&A Maram and all the partners and collaborators this afternoon. So far, this has been an amazing opportunity, lots of information. As we are a little bit behind, we'll try to catch up. So no matter where you are in the world today, your life will have been touched by the COVID-19 global pandemic. As somebody has mentioned already, this has been a very unusual situation. To respond effectively to the rapidly evolving COVID-19 and public health emergency situations, healthcare organizations in the UAE have established comprehensive preparedness plans to deal with the crisis. Response has been rapid, and I think someone has said already agile, which it has, through implementation of emergency contingency plans. And while normal operations for many hospitals and healthcare facilities has been severely disrupted, which we have touched on already. Safety of patients and frontline workers continue to be paramount. So the overall discussion for us today will be about, will the profession and the emergency management sector continue to undergo changes as we face the future? I'm delighted to have our esteemed and well-informed panelists to take some questions and to give us some quick take-home messages. We have heard quite a lot already about the new normal around technology, which is a critical enabler. So when we get to we're going to look at the new normal as well. I'm going to concentrate on workforce, which is also a key enabler. So without further ado, I'm going to go to Dr. Emmanuel from Mohammed bin Rashid School of Government. Good afternoon, Dr. Emmanuel. I would like to ask you to just give us some further information around current research that's available and coming from the UAE in relation to the response and management containment of COVID-19. And then maybe a little bit about how we apply this new information that comes from research. Over to you, Dr. Emmanuel.
Thank you, Helen, and thank you, panel, for today's session. This great speakers earlier was quite impressive as well. So in response to what is the current research we have here in the UAE with respect to the preparedness when it comes to dealing with pandemics. In the UAE here, we have, I would say we are in a blessed nation, and we are quite fortunate to be in this country. I'm originally from Trinidad and Tobago, and I've been here in the UAE for the last 12 years, working with the Mohammed bin Rashid, just over 8. This year, we've worked at the School of Government, one of our policy areas of research is health policy, where when the COVID came into being, we did a rapid response report, as you can see on the screen here, where this was a joint work done under a World Health Organization grant, in order to see what was happening in terms of the response towards COVID. In summary, we found over 87 policies within the UAE that has been responding to those non-pharmaceutical interventions. And for the purposes of today, I'll just be focusing on the readiness. Those data set is being with Harvard at the moment. One of our journal articles published recently highlighted evidence for 4 main factors that has shown the UAE in the light when it comes to preparedness. Firstly, one, in terms of the coordination of the emergency tasks. We know the UAE's National Emergency Crisis and Disaster Management Authority, they've put a task force in order to best manage and coordinate the various activities for limiting the spread of COVID-19. The second evidence that's really unfazed is the ensuring that capacity and training has been done. Just over a year, the Ministry of Health and Prevention run a series of workshops for their staff, especially working in the emergency response, all in the effort of, it was in plan for the Expo 2020. However, a series of these professional developments were done so as to train those that are working within the field. Furthermore, the third element, the third and fourth, which goes hand in hand, is ensuring and equipping the country as a whole to be very prepared when it comes to health resources, as well as your health services. Now, in terms of the health resources, we know that there's, as of today, there's over 9.3 million COVID tests that has been done so as to contain the spread of the infection across the UAE. And then in terms of the health services, we also know that, the construction of field hospitals so as to increase the bed capacity across the UAE was also some evidence. So just in summary, these were some 4 main factors of evidence that has put UAE in a positive light in best managing and being well prepared for this crisis.
Thank you, Dr. Emmanuel. Very interesting. I'm going to move now to Dr. Aniruddha Lahiri from Zaleika Hospital. And I'm going to ask you again, Doctor, about the new normal, and perhaps with an emphasis on workforce, which Dr. Emmanuel mentioned, the training, the upskilling, etc., very important. So we have been hearing a lot about the new normal. What is the new normal in healthcare? You run your hospital administrator. And what are we doing differently to assure safety in healthcare as part of the new normal? And what is the difference it's made to our professional workforce, and particularly the emergency management sector? Thank you, Dr. Aniruddha.
Thanks, Ellen. As just rightly Dr. Emmanuel mentioned, that this COVID-19 has actually changed our entire ecosystem, the global ecosystem. And we have actually come to a complete new scenario, which we never experienced, and it is an event of the century. So thanks to our UAE government, who has taken so many proactive steps to control it efficiently. So whenever we are incurring such event, such pandemic, actually we are going through 3 waves. This wave 1, which we call mobilize, wave 2, we call it stabilize, and wave 3, we call it strategize. So in last couple of months, we have seen the mobilize. Mobilize in the sense, mobilizations of manpower, resources, bed management through our command centers. Beautiful work done by the entire UAE government. And we saw a very best collaborations first time between the private and the government bodies so nicely. So we can take patients, we can prioritize, we can disseminate each and everything we have seen. So after this mobilization part, the second most important part, which right now we have entered, that is called stabilize. And stabilize has no less value, because stabilization is basically a bonding where we are gradually reopening and rebuilding based on the social cohesion and wellness to recover the economy. So you understand, after a certain period of close down or international lockdown, the major problem which is happening and which is affecting the entire industry, that is the economy. So we have to recover the economy. At the same time, we have to take care of the well-being of the society. So this new normal is basically this fine balance. New normal is nothing but apart from the learning which we got for the first wave, that is the mobilize. So all the learning we are implementing here. So using PPE is basically our new normal. Social distancing is basically our new normal. Cohorting and dividing the workflow for a communicable disease or non-communicable disease, it is a new normal. Scanning through a camera whenever a patient is entering the hospital, it is a new normal. So basically the new normal is based on 2 things. One is the safety of the staff. Second one is the safety of the customer. Safety of the staff we can maintain with this all usage of PPEs. Safety of the customer, the first part of the safety of the customer is we have to maintain the safety, as well as we have to percolate the message of this safety. Why it is so important? Because if you see, particularly as you were telling about the emergency, if you see the emergency department, who are the forerunner of this entire event of COVID-19, they have served so many communicable patients, but at the same time, we have seen a drastic drop of non-communicable problems in the emergency. So we have seen much less number of heart attack patients in emergency, much less number of renal emergency, much less number of other sepsis patients in the emergency. So the question is, where are those patients? Are those patients not there? Yes, they are definitely there, but out of fear, patients are actually hiding those, they are not entering into the hospital. So we have to give them message of safety that we are here to take care of. and which is neither good for the patient, which is evident by the increased number of cardiac attacks in the community in the last couple of months, neither good for the hospital because it is basically hindering the financial sustainability. So this new normal, we have to follow it. And as I told you rightly, that this is the balance between the economic recovery and the social well-being.
Thank you very much. Very succinct indeed, Dr. Anna Yuda. I'll be back to you for some key messages. I'm now going to move to Dr. Sally, who has huge experience having in her laboratory where they've done over 500,000 COVID tests. So the first question I have for you, Dr. Sally, is can you update us on the current status of vaccine development in the UAE?
Well, about 30,000 volunteers have been included in the UAE third stage vaccine trial for the COVID-19 so far. We have started in July. Most volunteers have been given the second dose already. We will continue to test the specimens or the patients for 1 year. Hopefully, soon you will get some news about the effectiveness of the vaccine. We have been given, the DOH has given already the emergency use authorization, and I believe that reflects a lot of trust that has been given to the vaccine and a lot of hope for people for the success of the vaccine.
Fantastic, thank you for that. Dr. Emmanuel, I'll just pop back to you. Do you want to offer anything on this from an academic perspective around vaccine development?
Sure, thank you. To add to Dr. Sally's note, it's important for us to remember, based on the general directive from the World Health Organization, Dr. Tedros, where he says as a UN health agencies, they will not recommend any corona vaccines before it is proven to be safe and effective. So it's what the approach the UAE is doing at the moment, and they're rolling out in the next phase of the vaccine trial. You know, being patient is one of those key factors that we need to be mindful of, and we need to ensure that it's quite safe and effective for the population as a whole.
Thank you very much, Dr. Emmanuel. I'm going to go back to Dr. Sally, if I may, given your phenomenal experience around testing, which is a very big issue in this pandemic. So testing procedures and advice presumably are continuously evolving. What can you tell us about efficacy of current testing procedures, and what kind of technology is being used to ensure the most accurate results?
Well, I have to tell you, Helen, I have never seen the lab world move as fast and as creative as the past few months. It has been phenomenal. The technology has been evolving in a very impressive speed, producing new methods, new machines every day. The knowledge and awareness has been raised among everyone, not only lab personnel or medical personnel, even non-medical people now understand what is RT-PCR, what is antigen, what is antibody. The knowledge is really extensive right now. Well, we have a lot of methods in the market right now, and we have been testing extensively to, bring on board the most accurate and the most the highest throughput and the most productive method. Right now, we have molecular methods and non-molecular methods. Of course, molecular methods are the gold standard, particularly the RT-PCR. Well, there are new methods in the molecular pathway. A lot of methods have been introduced, such as the LAMPOR sequencing, such as a lot of POCT machines that are equally sensitive and specific, the CRISPR method, the isothermal amplification method, or the RT-LAMP, the molecular microarray. Some of these have been already commercialized and others are under development right now. Of course, while introducing a new method, we have to do full validation. We have to ensure that the analytical sensitivity and specificity are as claimed by the manufacturer. So it has to be tested extensively first. Apart from the molecular methods, we have also the antigen testing and the antibody testing on board. There has been a lot of controversy about the use and the utility of these tests. The antigen has been found by many articles to be very specific. However, the sensitivity is still questionable. Many methods are in the market. Depends on the method, the sensitivity will vary. And thus, again, in-house validation has a big role in comparison, of course, to the RT-PCR. Antibody, on the other hand, is not really used for diagnostic methods. It's more used for seroprevalence or serosurveillance. And now, of course, we are using it to follow up the vaccine trial. The sensitivity and specificity cannot be really compared to RT-PCR because the use is different. However, there are multiple methods that are available in the market, especially the neutralizing antibody assays. There are quantitative and qualitative assays, and it also can be used with the RT-PCR just to increase the sensitivity of the RT-PCR, especially with negative cases where, you know, at the end of the disease, where the viral concentration is much less than the beginning of the infection. So many utilities are there. Sequencing has also been introduced into the market, and it has a lot of utilities, understanding the mutations, understanding the drugs, the diagnostic assays, the vaccinations, you name it.
Okay, thank you very much, Dr. Saleh, and thank you, the panelists. I'm just going to go back to each one of you, if I may, for a key take-home message. So I'll start with Dr. Manuel Azad, please.
Thank you, Helen. So basically, it's really important for us to learn from the first wave lessons that we have experienced during the times of crisis. Also, it is very, very important for us to start considering priority settings when it comes to public policy, reshaping and reforming, reimagining health strategies as a whole. So it's so critical for us at this time to have those mobilized teams in place for developing policy insights and setting the directions and executions and making sure that we learn from the lessons from the past. Thank you.
Thank you so much. That's very well put, very eloquent. I'm going to move to you, Dr. Anuruddha. What is your key take-home message?
As we just discussed regarding our new normals, our vaccines and rest of the things. So I understand the major key points on everyone's mind when exactly this COVID pandemic is going to be over. So, and nobody has this answer clearly. Multiple studies has been done. I just read one very interesting study, and I can tell you that is the most optimistic study, that is by the McKinsey & Company, which was published just a few days ago. So I thought just I'll be sharing few things from there. So they told that the concept of ending of the pandemic is basically depending on the two concepts. One, either that is the herd immunity development through epidemiology. And the second, people are actually got habituated with the normalcy. So if I first consider the first one, that the herd immunity, and I'll be just taking that point that it is the end of the pandemic. So it depends on few factors, not only vaccines. Definitely vaccine could be the most important point. But apart from vaccine, that is the natural immunity. Because if I tell till date, almost 300 million populations in the entire globally, they got the natural immunity by getting infected through this COVID. Apart from that, there are some cross immunities like other coronavirus, other variety, they are making some cross immunity. Some cross immunity is made by some other vaccines like BCG, calmette-guerin. Those are the other kind of vaccines which make this herd immunity. And apart from this herd immunity, which can be predicted as per this McKinsey report, they have given a 3 timelines. The earliest and the most optimistic timeline is basically second quarter of 2021. The most likely timeline they have given Q3 and Q4 or 2021, and if not the last one, that is in 2022. And the second most important part, that people are transforming in the form of normalcy. So that is basically a feeling of the populations. So when the population will be feeling that, when the population can do what they are desired to do without hampering or jeopardizing their own health and the health of others. So that time you can tell, okay, this particular situation has come up. So to get that particular situation, the most important factor is basically to lessen down the mortality rates, and which right now the various government and the private hospitals is working on that. A newer treatment strategy is coming up. Obviously, vaccines will be helping that a lot to bringing down the virulence. Apart from that, all the things which we discussed by the strategy of the government, by empowering the public health system and rest of the things, we can go ahead on this particular regard. So there is no end point, but the most strong word here will be the hope. Let's hope for the best.
Thank you so much. That's really helpful. And Dr. Saleh, how would you like, what take-home messages would you like to leave? I'm sure there's lots of questions for you all on the chat box.
We'll check them out. Well, Well, I believe we in the healthcare industry have been faced with extraordinary challenges, but we have shown resilience and we have dealt with it very well, especially in the UAE, where the management has really been outstanding. But now I think the focus should be on the relaunch plan. I think we should focus more on automation, AI business, machine learning. This will also include more safety and infection control measures. I think we are lucky, as previously said, that this pandemic has drawn attention to science, to research and their value, the safety measures that was previously ignored, infection control measures. But now we will get used to the normal, and I think the healthcare will embrace this and will lead to a more efficient and streamlined operations to a greater percentage of the population, hopefully.
Thank you very much. So we have heard some great insights here this afternoon from our panelists. I'm sure we could talk to them all day if we had the opportunity about research, the new normal, and vaccines and testing. Very critical elements. I think one of the big messages has been learn all the time and plan with that learning going forward and be patient. Thank you very much to Dr. Salih, Dr. Anar Yuda, and Dr. Emmanuel Azad, and to the organizers of the conference.
Thanks.
Fantastic opportunity.
Thank you, Helen. Thank you very much, Helen.
Thank you.
Thank you. Thank you so much to you all. Thank you, of course, they're going to Helen and all of our panelists. Now we move on to our talk show part of the summit. This discussion will highlight the role of the private sector during the crisis and the challenges ahead. Listen now to Asma Ali Zain, editor for Q&A Markham, who will have an in-depth discussion with Dr. Shehbaz Bichou, CEO and specialist anaesthetist at hospitals and clinics, and Mr. Aliasgar Bohari, Director of IT at Zulika Hospital, on how hospitals, healthcare providers, and healthcare professionals, both private and public, began a mammoth effort to ramp up their current infrastructure and organize themselves to manage the emerging cases, set up new clinical protocols, and allocate additional resources and manpower. Please now welcome, as I thank you, Asma Ali Zain, Dr. Shehbaz Bichou, and Mr. Aliasgar Bohari. Let's welcome you all. Thank you.
Hello, welcome, Dr. Shehbaz.
Hello, hi.
Hi, good to have you on the panel. So we had a very interesting sessions starting from the afternoon until here, and we couldn't leave the most important bit out of it, which is the private sector. So the private sector was totally part of the entire crisis management team that was put together by the government and everyone. Otherwise, it would not have reached this stage. So as Kara was mentioning, we set the pace for today's talk show. And obviously, there was a lot of burden on the private healthcare, the private sector, and all that. So I just wanted you to talk about the, we have been talking about the challenges. Maybe we can talk about the opportunities that have come through of this entire situation. So I'll just start off with Dr. Bichou. I'll just like to ask you a question on this thing. You have been through the eye of the storm. And what were the immediate steps as a private sector had to take to mitigate the crisis in terms of manpower, finances, and day-to-day operations during this time?
Good evening, everyone. Pandemic came as a surprise for us, like everyone else. So we never expected it to be so deep. So initially we thought, we've been to certain pandemics like Nipah virus back in India. So we had, when we say we, our organization had a prehistory of managing some pandemics like this, especially the one called Nipah virus, which was back in India, in Kerala. So we expected the magnitude to be not so severe. So with the learnings what we had, first thing what we did was we started brainstorming with our people in India. So the people in India were who's who in virology and things like that. And then we started putting some things in place. So a couple of things which we knew which is going to directly hit us. Number one is infection control within this hospital. So we know that if we don't take care of appropriate care and having an infection outbreak in the hospital, we'll end up in soup, especially losing our staff. So that was one of our challenges. So main thing was, main strategy was protecting our staff. So we have put that things in place. And then later, what came as surprise was the lack of PPEs and things like that, wherein we never expected it will just go out of our hands. And what we went through was a very painful situation wherein PPE was not available. So without PPEs, it was very difficult to send our soldiers to fight without weapons, right? It was something of that sort. So what really helped us was we had this catch-up meeting every day morning, 1 hour. We had a brainstorming meeting, wherein this task force included the medical, the nursing, the purchase department, and the operation people, and we all sat together, and then we put a lot of technology in place to help us. So that's the reason why we could fight it. Ms. Asma, you are on mute. We are not able to hear you. You're mute.
Sorry. Got it now. So basically it was like the entire operation, your day-to-day operations, your finances, your manpower, you had to sit down daily to actually sort out these issues. And Kerala itself, I think your health minister had a very good example. I think she was leading from the front. So you had an example to follow, right?
So all that is coming from the previous Nipah experience. You know, the Nipah virus was much more dangerous virus than this, but it was not as contagious as the corona, but it was more, mortality rate was much higher. So we had just finished that phase of Nipah. So that gave us a lot of learning experience. So we brought all those experience and then started doing it, but we never expected it just to go out of our control.
Yes, indeed, it hit all of us actually. So just coming to Aliasgar, the past few months have actually been tough, but they have also given an opportunity to the technology sector. We have discussed in the previous session a bit of it, but what was the UAE's preparation in the technology side on this? What is your opinion on that and experience as well?
Okay. Good evening all. Just to mention here that this is the problem of virtual meeting. You have to unmute your mic and switch on your videos. You know, so that's how it started. But the thing is, if you talk about the technology, UAE, we are the blessed country. We are in the blessed country because UAE is already, it was ready before pandemic itself that everything is E and M. E stands for electronic and M stands for mobile. So if you see any industry in UAE or any health sector or any public, private sectors, governments, everything is available with E. So you have e-government. So talking about technology, I think UAE is the only country where there is a very much importance of the technology, which we are seeing it now. Now talking about in healthcare industry specifically, so if you see, there are so many hospitals or so many healthcare sectors which were ready before itself with the technology. And what COVID-19 has taught us, that is very important, that everybody now understands the value of the technology, which is very, very, very important. That everyone knows that what is the value of technology, how to use the technology in their specific industries. So talking about healthcare, if you talk about, then we have done, or so many other hospitals have also done about telehealth and having so many different technology, which is like, virtual meetings and the social meetings. But if you talk about actual relationship between a doctor and a patient, our Dr. Zulekha always says, which is called as a magic of caring touch. So not all virtual meetings can do this. So there should be that kind of touch, which is more required than the technology, a relationship between a patient and a doctor. So that's how you know, and the technology in every industry, as previous keynote speakers also have mentioned, that there is a major hit on the healthcare industry. If you talk about that, patients were scared to visit the hospital. So how to keep that touch of the doctor with the patient. So that's what everyone has introduced, telehealth. Telemedicine, telehealth was like, you know, it's not like that. It was not available before pandemic. It was there, but the use of optimum utilization has started once we have seen that there is you know, scope of telehealth more when such kind of crises are available.
Just to add on a point on what Ali Sagar said, right? So what COVID has done, so we were talking about all negative part of COVID, when you talk about economy, when you talk about disease, but one good thing what COVID has done is it has just pushed us forward 5 years ahead in technology. So I still remember we were having discussion of eICU, electronic ICU with doctors, and they said this is literally impossible. You know, when you talk about telehealth, they say it's literally impossible. But COVID has made this happen, and you like it or not, that becomes a new normal now.
And everyone, if you see everyone, any CEO, anyone, any owner, they're all talking about technology. They're talking about AI. They're talking about robotic process automations. They're talking about you know, telehealth. So this is the best part, as Dr. Bichu said. There is a best part which has happened, that people or the you know, they understood the value of the technology, which was already understood by the UAE government. If you see, because we are much ahead in terms of healthcare technology, in terms the DHA is giving us, you know, they are telling us to use this kind of technology. They are always guiding us what technology you have to use. So it's already there.
Right. I actually want to add something to there, because yes, you have already mentioned it, but I just want to ask both of you. We are talking so much about technology, and you just mentioned the human touch, which still remains important. I mean, I'll talk as a layperson. I would like to go and see my doctor actually, even physically. I know this is happening, but I'm having glitches right now. I can hear half of what you're saying and half of it disappears. So, you know, the satisfaction factor doesn't come through. So how do we blend this to both of you? How are we going to do it? And then, you know, how do we make the patient satisfied right now?
So, okay. If you really look at what technology, it's all about a cultural change, you understand, right? See, I'll just take, if you can just rewind us 20 years back, if you asked our granddads using card instead of money, they would have never been comfortable. They said, my entire money is in the bank, and you say you're using a card and swiping it. So it's all about the mental and the cultural set. I think we're going to change, and we are out for a change, and there's a huge change which is going to come in. So I do agree that the touch and all that, but then there are a lot of things which can be virtual, and people are going to digest it. Now the problem is we're not able to digest. People are still in a confusion whether will the doctor be able to diagnose me right when it's virtual, right? Once that confidence is built, I think things are going to be easy.
See, the talking about what Dr. Bichu has said, the caring touch is really required in healthcare. Even though there are so many technologies of telehealth is available, but we also build a confidence to the patients that, see, we are always available, even though you are not present in front of the doctor. So we are available with you in terms of technology. You can always connected with us. So that's what is the new normal of the next.
Right. That I'll just move on to my next question and just taking it forward. It's really nice to see you both talking to each other. Actually, that is what the point of this discussion, the talk show, was, to have the entire discussion on this thing. Dr. Bichu, I just want to ask you something. So what are the salient lessons that we have learned as a private sector during this time? Doctor, you're on mute now.
Mute, unmute.
Yeah, I'm sorry. This is one of the thing about this Zoom meetings, right? You don't know when are you on mute and when are you on unmute. Sorry for that. So yeah, a lot of lessons, right? If I start looking at from each point of view, right? Whether it's financial planning as a CEO, right? Whether it's on the financial planning, whether it's regarding my manpower planning, everything has got they've really given me a complete different picture on what exactly things has to be. So on the risk mitigations, and then see, we do a lot of drills, even you say fire drills and pandemic drills, but behind our scene, right? We know that that's not going to happen. But this pandemic really taught us that. See, especially everything what was taught before in terms of keeping the stocks, stock held days, ready, managing your cash flow. Everything is completely shifted into a next level, and that's a huge learning lesson in each and everything. And one of the major thing what we learned over here was we had a lot of nursing manpower shortage because of overwhelming of the patients. So we did a lot of cross training. So most of our nurses who were not ICU trained, we trained them. So, and that training, which otherwise would have taken us 1 year, happened in 1 month. So it just unleashed all the potential in us.
Right. Yes, would you like to add anything to that?
No, what he said actually, that's how happened with every healthcare industry. To add on to this, how technology has supported this next level is like what we did, or I'm sure all my CIO colleagues have did the same, that they have done. First of all, they learned from this COVID to have business continuity planning, which which we were having it long before, because we are all 3 ISO certified, so we have done that. Then most important thing is security, because there was so many cyber attacks and health attacks done when you talk about this kind of pandemic. Then very most important part here I would like to say is about data. Everyone has a huge and tremendous data available with every industry, I'm sure, because who are in the business, they have a lot of data available in their health systems, HI systems. Now, using that data and taking informed decisions is the major role played in this particular pandemic, which we have seen it. And we have also, if you see, also we have done which is called as an process reengineering. So all business process reengineering actually has been worked out very well with us, with the data, the MIS reports, everything available, using that particular data to take the decisions, because everything is unpredictable. If you see, there was no budgeting, nothing. So on what basis you are going to take any decision? So important is data. So digitization and all other things. Apart from that, using your data in a correct way was that was the best thing happened in this pandemic. I'm sure Dr. Bichu will also agree on this.
I agree with Ali Sagar. It really taught us how to ride the motorcycle with blindfolded, right? What you decide today is not what you decide tomorrow. And whether it's be finance, manpower, everything has gone for a toss. So it's a trapeze.
So just winding up. Right. So just winding up and coming to my last question, you briefly, Ali Asghar, answered it. We'll just finish it off with the kind of preparations that the IT industry is facing, the challenges. What kind of preparations are you doing to overcome these challenges? Yeah.
So that's what I have mentioned already. Like, use of right technology on right time is the key mantra here. Plus, whatever the person, like whatever industries, or they have not done any investments in the technology, this is the right time to invest in the technology. Use the right technology, right time, use your data for your informed decisions, okay, whatever you are having it, and please make your business continuity planning. So that's the key thing right now, data and business continuity planning. That's the two important things which I would like to tell everyone to do it. Yeah, thank you.
Right. Would you have anything to add, Dr. Shahbaz, before we wind up? We are just, I think, in time, and it's a very interesting talk. We could go on, but then if anything, we can add words to wind it up and give a message to our audience.
So only thing is, see, this is not going to end in what I presume is it's not going to end in another 2 or 3 months. So it's for all those who are from healthcare sector, I would say that we need to be better prepared. So go back, look at what mistakes we have done in the previous thing, and make sure that it doesn't repeat. And like Mr. Ali Sagar said, one of the things what we need to equip now is on technology. And then this pandemic has really proved that, you know, technology is the main thing which is going to really come and help us in terms of leaning all the process, leaning all our manpower. And I think technology is the only solution which can fight this pandemic.
Right.
And please don't forget to use your sanitizer and mask. As you see, you know, you have one sanitizer bottle and the mask with you. Always keep it.
Right. So it's a pleasure having both of you, and the message we are taking is basically preparedness and use of technology, data that we have to be ready with. Again, thanks a lot for your time and being on this interesting discussion. Over to you, Para.
Thank
Thank
you.
you so
Thank
much.
you. Thank you.
Thank you, Asma Ali Zain.
Thank you.
Shahbaz Bishu and Mr. Aliasgar Buhari for that wonderful session there. Thank you so much. This focus again on the new normal now also to remind us all to take our mute button and our unmute button constantly throughout. So funny, the new normal. Okay, we have now come to the end of our summit. Before we move on, I would like to thank our event partners, without whom this event would not have been possible. So a big thank you to ThinkSense.ai, Jenks Systems, D-Link, Reddington Gulf, Novo Healthcare, ICT Circle, Tectonic, and Exclusive Networks. A heartfelt gratitude also goes out to our esteemed speakers and panelists who have taken the time out to be with us and enlighten us with their expert opinions today. So thank you once again to you all. As we now move forward to the awards ceremony, the awards part of today's summit and awards. So without further ado, ladies and gentlemen, welcome to the HCM Awards, powered by Q&A Marken in association with the Dubai Health Authority. Feel free today to get social with us and do use the hashtags as followed: HCM Awards and also hashtag Q&A Markham across your social platforms. That's HCM Awards and Q&A Markham across those social media platforms. We all like to be social, so get those hashtags out there. In this session, we will recognize and honor the heroic efforts of individuals and healthcare management teams for the extraordinary work done by them in crisis management during the COVID-19 pandemic, through innovation, foresight, and unique strategies, thereby enhancing safety, continuity, operational efficiency, and contributing to the nation. So as we build now to our atmospheric moment of our awards ceremony, I shall be playing that triumphant music behind the scenes so that we can have our music as we go. So bear with me, here it is. As we start to congratulate now our winners, moving forward for the Healthcare Crisis Management Awards, our first set of recognitions are the Healthcare Leadership Awards. The first winner in this category, we have Dr. Iman Omar Al-Sheikh, Emergency Physician, Team Member, Emergency Preparedness Plan for Rashid Hospital, DHA. Well done to you. Well done there, Dr. Iman, taking away that certificate and the huge recognition. Congratulations going to you. Our next winner, we have Dr. Raza Siddiqui, CEO, Arabian Healthcare Group, Executive Director at RAC Hospital. A huge congratulations going out to Dr. Raza. We had the pleasure of speaking to you. And our next winner, Dr. Manal Al-Tarayam, CEO for Primary Healthcare Services of DHA. Well done to you, Dr. Manal. Excellent efforts. And our next congratulations to Dr. Yasser Naklawi, Chief Medical Officer for Al Zahra Hospital, Dubai. Congratulations, Dr. Yasser. The next winner, Dr. Ahmed Saleh, Director for Corporate Medical Services, Prime Healthcare. Well done to you. Our next winner, taking away the certificate, is Dr. Emmanuel Azad Munessar, Associate Professional Health Administration and Policy for Mohammed bin Rashid School of Government. The following winner, Dr. Aniruddha Lahiri, Director of Administration for Zulika Hospital, Sharjah. Well done to you, taking away your certificate there. And our next winner, Dr. Sally Mahmood. We have you for the Lab Director at G42 Labs, Biogenics Labs. Well done, Dr. Sally. Our next winner, Dr. Sherbaz Bishu, CEO for Asa Hospitals and Clinics. Dr. Sherbaz there taking his certificate. Our next winner, Dr. Mohammed Khalid, VP Critical Infrastructure Protections and Resilience, Group 42. Well done to you, Dr. Mohammed. Our next winner, Sumit Singh, Group CIO for VPS Healthcare. Huge congratulations going to you, Sumit. And taking the next certificate is Vignesh Unadkat, COO for Thumbe Group. Well done to you, Vignesh. Huge congratulations. Did you take your certificate? Our next winner is Saqib Chaudhry, Head of Digital Innovation and Development, Cleveland Clinic, Abu Dhabi. Well done to you, Saqib. Our next winner, Ramakrishnan Natarajan, Vice President, IT, Emirates Hospitals Group. Well done. We had the pleasure of speaking with you earlier. Congratulations to you. Our next winner, Aliasgar Bohari, Director IT at Zulika Hospital. Well done, Aliasgar, taking your certificate. Getting the next certificate is Jalil Raiman, IT Director for Prime Healthcare Group. Well done, Jalil. And our next certificate is going to Ali H. Pinaim, Director of Information Technology, Canadian Specialist Hospital. Well done, Ali. Your acknowledgement certificate going to you there. The next, Mohammed Jamal, IT Director for Al Zahra Hospital. Well done, Mohammed. Our next winner, Mustansia Aziz, IT Manager for Gulf Diagnostic Center Hospital. Mustansia, well done to you. And our next winner, Dr. Alka Kalra, Psychologist for Egistan Institute. Well done to you there, Dr. Alka. Our next certificate going to Shairun Khan, IT Manager for Emirates College of Technology. Well done to you. And our next certificate is going to Helen King, Senior VP Quality and Nursing at NMC Hospital Group. Well done to you, Helen, taking your certificate there. The next winner, Fodil Bentrukia, Founder and CEO at Okadoc. Well done to you, Fodil. And the next certificate, Mohammed Numan, Optometrist of Ministry of Health. Optometrist, well done to you. Our heartiest congratulations to the Healthcare Leadership Award winners there. Well done, Mohammed. Well done to you all. As we swiftly now move to our second set of awards. Now these are honored for HCM Summit Institutional Awards. The winners for this moving forward, our first winner, we have Ream Hospitals, Vamid Healthcare. Well done there to you. The next certificate going to NMC Hospital Group. Huge congratulations. The following winner, Danat Alimarat Hospital. Well done. Taking away your certificate. And the next winner is Al Noor Medical Center. Big congratulations going to you also. For the next, we have the certificate going to our British Dental Clinic. Thank you, and a big congratulations once again. The next certificate going to British Urology Day Surgical Centre. Huge congratulations. Our next winner, Alain Hospital. Alain, well done, taking their certificate. And the next certificate going to none other than Al Sharq Hospital. Al Sharq, well done to you. The next going to Cigna APCO Worldwide. Huge congratulations there, taking your certificate. And the next going to Mediclinic Middle East. Mediclinic taking their certification. Our next winner is Belhoul European Hospital. Well done, Belhoul. Our next certificate is going to Health Bay. Big congratulations over to you there at Health Bay. And our next winners, SRL Diagnostics. Well done, SRL Diagnostics there, taking their certificate. And the next going to Gulf Diagnostic Center Hospital. Taking your certificate, Gulf Diagnostic Center Hospital. The next winner, Aqua Pharmacy. Huge congratulations to Aqua Pharmacy. And our next winner, Al Noor Group of Clinics. All these certificates going out to our worthy winners here. The next winner, Alpha Tame Health. Alpha Tame Health taking their certificate. And the next, Milk Healthcare. We have them taking their well-deserved certificate there. Congratulations. And now the next winner, Dr. Leila Sudha Clinic. Huge congratulations going to you. The next certificate we have is going to Dubai London Specialty Hospital. Big congratulations to all of you. I hope you are all giving yourselves a huge round of applause. The next certificate going to Exeter Medical Center. Big round of applause to you as we acknowledge our next the Iranian Hospital taking their certificate. Congratulations. The next winner, University Hospital of Sharjah, taking their certificate there. Next, we have our Buddy Group, our winners. Well done for your certification. And the next certificate going to Jubaili Brothers. Well done, Jubaili. Excellent efforts there. Your certification. The next winner, Sultan Qaboos Hospital. Sultan Qaboos, taking your certificate. Congratulations going to all. And the next certification going to Suleiman Group. Well done to you. Our winner, Suleiman Group. Our next winner is RAC Medical and Health Science University. Taking your certificate. Well done to you. Our next winner, the American Hospital, Dubai. Huge congratulations going to all of you. And the next certificate we have to acknowledge Sheikh Khalifa Medical City for all their efforts. Well done, your certificate there. Congratulations to all our institutional award winners. Big congratulations to you all. Once again, I hope you are all giving yourselves a huge round of applause on this very, very special occasion here with the Summit and Awards. I would like to congratulate all of you once again and remind you that we do have those 3 winners of those Apple Watches. We will make sure to get those names to you and make sure that you are awarded duly with your Apple Watch. I hope you have enjoyed today's Summit and Awards, and a very well-deserved and big congratulations to all of our winners once again. We've now come to the end of our awards ceremony, and I would just like to say a big thank you once again to all of our audience for taking the time out today, and congratulations to all of our winners. I'd also like to thank once again our event partners, without whom this event would not have been possible. A big thank you to ThinkSense.ai, Jenks Systems, D-Link, Reddington Golf, Novo Healthcare, ICT Circle, Tectonic, and Exclusive Networks. Once again, a big thank you to all of you for joining us here. It's been an absolute pleasure from myself, Cara, hosting you here today. I look forward to seeing you all again. Stay safe, stay well. Thank you so much. Take care. Goodbye.